so much. You can take seats. Director, I can come this side of the planning and take a seat. Let me confer immunity to the two PS for the Minister of Media, and the PS for Minister of Health, and PS for Local Government Technical Services will be welcoming this afternoon. Very short for the two PSs, then we will endeavor our colleagues to continue with our meeting. Maybe just to bring the two PSs to speed, we had a meeting yesterday, our deliberation with the PS for Media, Mr. Tawakawa, and PS Piri. We had to call you today so that we can extinguish one matter, which was, there was a point of order which was raised by the Honorable Member for Victoria Central concerning what transpired, I think, on a press briefing. And let me just bring it to your attention first and foremost that we are one government, the executive, the legislature, and the judiciary, and our role is to provide oversight of each other. However, Parliament oversight of the executive, that's why we are here as Public Accounts Committee to give oversight, as it were. And if you look at when you come, we confer you with immunity in accordance with Chapter 12 of the laws of Zambia, which gives you immunity as you make submission. That is Section 19 of Chapter 12 of the laws of Zambia, which is the National Assembly Powers and Privileges Act of the National Assembly. Who commits any act of intentional disrespect or to interfere to the proceedings of the Assembly or the committee of the Assembly or any other person presiding over such proceedings. Like I mentioned earlier, we are one.
And let me make mention that what started emanating is that in a committee, even as we don't debate on the floor of the House what we are deliberating on a particular meeting, because we are not allowed by Cap 12 of the laws of Zambia. But however, government is at liberty any time to give a position on the general status of whatever subject it might be. We don't have powers to stop. I should be very clear. Government has got liberty to make any corrective measures, but the name of a Public Accounts Committee or Parliament should not be brought to that fora, as it were. So we thought of discussing with you, our PSCs, that that is the position, what is stipulated in the law, as well as in the standing orders of 2024, and is emanating from that press briefing which was held, that I think we should look at this issue critically as we move forward to ensure that we are all carrying out our functions separately as we provide oversight, and as also implement policies on behalf of the Zambian people as people conferred with immunity. So I thought of coming to make a ruling today to what Honorable Mwila raised yesterday on this floor of this committee, that yes, it's not in order to mention the Public Accounts Committee or the Parliament, as it were, because we are a committee of Parliament, and for such matters, I think until it's finished, the deliberations are finished, and we produce the report which we table before the Speaker and debated in the House, and then so forth and so forth can proceed as well, because that becomes a public document. So I thought of coming to make that ruling before our 3 PSEs, I think, because you attended that press conference. However, we thank you so much, PS Tabo Kawana, for coming through, and also PS Piri for coming through before this honorable committee. I thought of just bringing this to attention. So thank you so much for coming. That was our role, to make a ruling to ensure that we are all at the same level. So thank you so much for your cooperation, and you can proceed with your engagements. I hear you've got engagements at State House. Thank you so much.
Thank you, Chair. We are well guided.
Thank you. Immunity is lifted. You can proceed to your duties, and we'll continue with the PS Minister of Health. Thank you.
Thank you, Chair.
Thank you so much. The Director Planning, you can revert back, and before adjournment, we are discussing issue of the interrupted power supply for Chipata General Hospital, which I think PS in your submission, you said the procurement processes had progressed with ZAMSA. So we just wanted to hear the comment, and I think the person in charge at Chipata District Hospital has highlighted that it's not a normal UPS like we are thinking, but that UPS comes with a staggering amount of $50,000. So I'd want to hear from ZAMSA, how far have we gone with procuring this aforesaid UPS for Chipata General Hospital? Then you can proceed. So I will ask Auditor General and the Office of the Controller to step back. Then ZAMSA can come in front to answer that question. Then honorable members, I think there was an outstanding question. I don't know, Honorable Mfarari of the ENT specialist. I think that can also be addressed. PS and Auditor General, I didn't say you go out. I say you sit just behind, because unless there's another issue. Okay. So thank you so much. The procurement for ZAMSA, if you are there, I think you can quickly rise to the occasion concerning the procurement of the UPS for Chipata General. Thank you so much.
Honorable Chair, honorable members of this committee, with regards to the tender for the supply, delivery, and installation of 3-phase uninterrupted power supplies for the CT scanners at Chipata Central and Kasama General Hospitals, the status is as follows. The tender was floated on EGP on the 20th of August of this year through open national bidding. It closed on the 21st of October. 11 bids were received. The evaluation commenced on the 11th of November and ended on the 6th of December this year. Unfortunately, there was a delay in the evaluation due to a system failure with the EGP platform, but they completed their initial evaluation, and in their report they had recommended to our procurement committee 2 things: to cancel the proceedings of the tender because they felt there wasn't enough technical information, and to refloat it, but the procurement committee rejected this recommendation. They felt there was enough technical information to allow for the tender to proceed, and hence there were that was a decision reached at yesterday's meeting, that we proceed with the procurement of these 2 pieces of equipment for the 2 respective hospitals. I submit, Honorable Chair.
Thank you. Honorable Daka, follow-up question.
Thank you, Mr. Chairperson. Of course, through the PS to the Director General for ZAMSA. Are you aware that it has taken more than 2 years for the CT scan at Chipata Central Hospital? Or in short, or rather, are you aware that it has the CT scan at Chipata Central Hospital has been non-functional for more than 2 years?
Thank you, Honorable Daka. Through the PS, I don't know if he's DG Zamsa was picking up that, or PS, you can proceed.
I just wanted permission for 2 minutes. I've been asked to call State House.
Thank you, PS. In that aspect, PS, parliamentary precedence. You can not leave here. Even your colleagues, I think there are little issues to be looked at. So at break, then you can call them. Thank you.
Thank you for the guidance.
Thank you. Thank you. DG can proceed through the PS.
Honorable Member, thank you for that question. I am aware that Chipata, with a few other hospitals, have had challenges with the functioning of the CT scanners. There are a number of issues that have led to that particular state of affairs, which I believe the Directorate of Clinical Care and Diagnostic Services are really in a better place to appraise us as to why these machines are not functional. However, I must concede that we are trying with all regard to ensure that this procurement proceeds and is carried out expeditiously. I submit, sir.
Thank you, Honorable Wanyima.
Thank you very much, Chairperson. Zamsa, thank you for your submission. I just want to find out when you received the request for procurement of this particular CT scan, if you have the dates when the request for procurement was received. Thank you very much. The UPS.
Thank you, Honorable Daka.
Of course, to the DG, of course. Looking at the agents of this matter, since you have admitted that you are aware about the non-functional CT scan at Chipata Central Hospital, what mode of procurement did you use to procure this this piece of the UPS? What mode of procurement did you use to procure the UPS? Considering that you know very well how urgent this matter is to people of Eastern Province.
Thank you. DG can proceed. Thank you. Through the PS.
Thank you for those questions, honorable members. The request to purchase these 2 pieces of equipment was received in a memo dated 2nd of August 2024. With regards to the method we used, I think I'll ask my acting director to probably address that. With your permission, Chair.
Thank you. The acting head of procurement, you can proceed and help us the method. And DG, I think what is also important, you said there was issues of wanting to stop because you didn't have sufficient specifications. Then again, your tender committee or whatever committee sat, is it yesterday to speed? I think what is important, tell us when do you conclude this tender if you are proceeding, so that we can put it to the end to say it will be concluded, and what will be the delivery period in terms of the aforesaid equipment, so that the people of Chipata can be assured that the process will come to an end and they will have what is needed. Thank you. We will proceed after your head of procurement. Thank you.
Thank you so much, Honorable Chair. We did vote this tender via the electronic government procurement platform, and the method used was the open bidding national. Thank you, Chair.
Thank you, Honorable Mfalari, then Honorable Amnima can proceed.
Thank you, Chair. Chair, through you to the controlling officer, to ZAMSA. I know that we have quite a lot of issues, controversial issues in terms of procurement, or procurement, as one of those ministers would say. Now, I believe, for me, I believe controlling, chairperson, I believe in doing the right things and doing it there and then. This is a specialized equipment that you are looking for, the UPS. And it's one of those things that you should not even start fetching everywhere. I don't know. You don't have to start fetching everywhere. You know where you got it, or you know people that are special. Why don't you just limit the same to those people? Because you go around, so why should we go around when you are supposed just, because this is what you have the mandate, you have the law gives you that power to say you can source. You can single source, because this is one of those equipments that we don't expect anyone to start crying foul, because it's a specialized equipment and you should be able to source it. Why are you failing? Why did you have to go all over fetching? And when you know that this equipment, unless maybe the client who happens to be the Minister of Health didn't give you the specs to say this machine was procured from this and these are the people that should have, or actually even yourself you'd be able to check across the globe who is the supplier of these, who are spare parts for these machines. Why did you have to go that long route? I submit, Chair.
Thank you, Honorable Amnyima.
Thank you very much, Chair. This question goes to the PS. Why did ZAMSA receive the request this year, in August 2024, when this query came up last year? And perhaps this has been an outstanding issue for the last 2.5 years, if not 3. So I just want to understand, because maybe we are not getting the process. ZAMSA is like a procuring entity. So if they are told to procure in August 2024, I don't think they can do any magic to have this equipment. So why did they receive the request this year?
Thank you. That's to the PS. My question, DG, I want to know when you are concluding. And there's a question from Honorable Mfarari that this is a justifiable cause. You can even do your direct bidding once you get permission, I don't know, through your processes, as it were, so that it can be, you can avoid this situation. So maybe advise through the PS, how long will it take you to conclude this matter, as it were? And why didn't you just probably direct bid and look at specialized people with that? Because it's allowable, I think. You can proceed DG through the PS, then PS you are going to answer Honorable Amnima's question. Then colleagues, we need to make progress. Thank you. So DG through the PS you can proceed.
Thank you, Honorable Chair, and I appreciate the questions from the honourable members of this committee. It will be sent back for authority to procure within the coming week, and the delivery period is 6 to 10 weeks.
Thank you. Why didn't you use the direct bidding since it's justifiable? Maybe you can answer that question, then PS you come in now with Honorable Amnima's question. Or you are fearing to be cited. You can proceed.
Thank you, Honorable Chair. At the time we didn't have sufficient information in terms of availability of the recommended suppliers in the market, hence we had to go for open bidding method. I submit, Chair.
Thank you. PS, you can proceed with Honorable Amnima's question.
So for the ENT services in Western Province, the status is that it's not fully functional. Simple things are being done, like looking into the throat, syringing, and so on and so forth. Only simple things are being done. The reasons are that twofold. Even if some pieces of equipment is there, the equipment is also not complete, because what there is a chair as well as a machine called a laryngoscopy, which is used to look into the throat. That's not the only equipment that you need in order to fully provide ENT services. In terms of human resources, and this equipment found itself there because we had
Korean specialists who were providing those services, but they are actually no longer there. And specifically speaking about human resources, the ENT specialty or specialty is one of those in which we don't have sufficient people trained to provide those services. Now, let me comment on referrals. We should endeavor to make referrals as fewer as possible by empowering lower levels of care. But quite frankly, it's referring patients will continue to happen because it's part of what we call primary health care. In other words, you provide the basics at the lowest level, sufficient to look after people. If they've got something that requires additional effort, they go to the next designated level of care, that kind of thing. It's part of what must be happening through primary health care. Thank you.
Thank you for those explanations. PS, we've been at equipment for over 2.5 hours. I think for us, this is a very, very important topic, and it's important that for us to be able to provide the healthcare services, we need to have these aforesaid equipments fully functional, and also we should ensure that we have scheduled maintenance plans through your planning. PS are not just here, you are maintaining here, we don't know here, it's stopped functioning. I think we should have a tracking system to ensure that we are on top of things in terms of equipment, as and when it needs scheduled for maintenance, as and when we need to decommission, as and when we need to procure the new ones, and also look at the processes as it were. And if things are budgeted for PS, I think we started having that challenge with CDF, where they will say until funds are received, then you start running with procurement. It started defranchising us. So we'll run with the processes, and then just look at the award level when the funds are there, then so that we can mitigate issues of lead time. So that is very, very important. So honorable colleagues, we make progress. We will have a position on equipment. PS, I was just from addressing your other colleagues together, and from page 10, you need to make a resubmission. That is ambulance services. So page 10, page 11, page 12, page 13, page 14, page 15, page 16, page 17, up to page 18 partly, you have to make a resubmission, because this submission is what you had made in your earlier resubmission in terms of procurement of these other 60 ambulances, and the tender has since been cancelled to that effect. So we want you to make a resubmission. Honorable colleagues, we proceed to page 18, support services, where we'll look at laundry services, lack of laundry equipment, Chipata Central, Matelo Level 1 Hospital, as it were. We can ask questions on those items from page 18, last paragraph, laundry services. Then we'll come and look at inadequate mortuary units, and you proceed as guided. You can proceed. Honorable Amnyuma.
Chair, can the PS guide us what is withdrawing here? I know that there are those 156, but also there are those being procured by the World Bank, the ambulances. So I think for what needs to be resubmitted, I don't know if the PS is aware of the scope of what needs to be. Maybe he can be guided.
So what I've guided Honorable Amnyuma is that this entire page 10 to 18 be resubmitted, as it were, because of the dynamics I think we are talking about, so that we can be categorical. Because I think from our preliminary issues, there are things which were raised, apart from the aforesaid tender which the PS submitted that is underway, which is no longer underway. So I think it's important that there's a total resubmission from page 10 to 18. I think that's the guidance. Page 10 to 18. Yes, Honorable Mukombe.
Chair, maybe the PS can himself withdraw, or maybe things have changed in his submission. We allow him to withdraw himself, so it's recorded.
Thank you. PS, you can proceed.
I think let us resubmit.
Thank you. We can proceed. Honorable colleagues, to page 18, the last paragraph on issue of laundry services. Service support, we have laundry services, lack of laundry services, Chipata, Chilenje, Matero, Livingstone, Kawe. Then we'll have now got to hospital mortuaries. You can proceed. Thank you, honorable colleagues. You can proceed as guided. So support services are both on laundry and mortuary units, capacities. Honorable Dak.
Thank you, Chair. Permanent PS, what interventions have you put in place to ensure that you conduct regular maintenance on these facilities? I submit, Chairperson.
Thank you. Honorable Mnyima can proceed. Yes, you can switch off the mic. Honorable Mnyima can proceed.
Chair, again, this again brings us to the same question as, do these equipment have regular maintenance in terms of the dryers and so forth, including the mortuaries? Is there a consistent maintenance program for this equipment? Thank you, Chair.
Thank you. Honorable Daka, you have, okay. Okay, thank you, colleagues. PS, you can proceed with that question, with those two questions.
So, thank you so much. Like rightly observed, these are all pieces of equipment, and basically they suffer from the same issues that we described. So what we need to do is to actually have a structured way of looking after these pieces of equipment going into the future, not the sporadics that have happened in the past. Thank you.
Thank you. Maybe PS, we want you to amplify. If you look at honorable colleagues, queries from that page 18 up to page 29, just 28. Okay, no, remove 28 also, so just 27, yes. 27 PS, we are dealing with equipment, kitchens, laundry, mortuaries. Mortuaries, look at your space, your standard number of units compared to the available. We have 300 compared to 16. Dollar Central, 300 compared to 35 we have. Chinsali, General, 100 required, we have 24. North Kasama, 100, we have 21. Northwestern, we have 112. That is available space in terms of mortuary. And also these other cafeteria services, lack of standard kitchen functional equipment, Kawambwa, all in all is to do with equipment, the status of equipment, being it kitchen, laundry, and mortuaries. And I'm still taking you back to your earlier submission that you've received funds for equipment but procurement process and you want to vary to pay for other services. PS, what is a roadmap on the aforesaid issues, as it were, to ensure that our people in these provinces are mitigated in terms of services to the hospital. Because these are general hospitals. When people are admitted, they need to eat. They need to have laundry done, as it were. So what is a roadmap on all these issues? And honorable colleagues, I want you to ask questions based on these items in general, so that we can augment each other. So what is the roadmap as the Ministry of Health to ensure that you mitigate the lack of kitchens, the lack of functional laundry, the lack of adequate mortuary space, as it were, in these general hospitals, which is a very important requirement, as it were. Thank you. Honorable Luma, you can proceed.
Yeah, PS, just like the chair has stated, what I want to find out from you, do you have a unit which helps you track in an event a mortuary in Chavuma has broken down, in Mansa, same day you are able to get that information such that that unit is maybe allocated some funds every year to ensure that come next year you don't have such type of queries and our people are able to receive good service delivery. I thank you, Mr. Chairman.
Thank you. PS, you can proceed.
So I'll start, and then with your permission, Chair, I'll ask my colleagues to weigh in. Like I said earlier on, all these are pieces of equipment, and they actually suffer from the problems that we spoke about in terms of non-replacement, because they were procured a long time ago and we did not have a robust plan in place. And also our maintenance plan has been, plans have been sporadic, not structured, and we promise that we are actually going to look at that. In terms of the roadmap for procurement of equipment, yes, we do have, and this is in an incremental fashion, and we should have distributed this piece of paper which speaks to some of the equipment that are already under procurement or have already been procured. And in terms of resources, the only reason we asked to vary was that we didn't want to lose money, because we are also going to buy to benefit the sector. And we have an understanding with our finance colleagues that will be asking for resources for the equipment that we plan to procure in the next years. It's better to apply the money to other things like drugs, which we also need, than take back the money as we negotiate for resources for next year. Mortuary units specifically, it is true we sit on very low capacities, and this is a legacy issue. Firstly, the infrastructure itself where these mortuaries sit need to be expanded, as well as also expanding the capacity of the refrigerators themselves. And again, part of that is part of the plans that we have in place, and you can speak to some of the issues related to mortuary. Sorry, Mr. Chair, I should have done that through you. So through you, Chair, Mr. Kalea will actually speak to some of the works that we are doing related to mortuaries. And finally, whether we have a maintenance unit, yes, we have maintenance units, but they do not, all of them have the expertise that they require in order to maintain the things that we have, especially at provincial and sub-provincial levels. With that, Chair, I would ask for support from the person from equipment.
Thank you, Mr. Mbere. Can proceed through the PS.
Thank you, Chair. So with the mortuary units, so far we had to procure about 10 units, which is not sufficient. And going forward, we have planned to procure more mortuary units in the next year's budget. But we have to also allude that some of the mortuary units are being assisted with the Ministry of Local Government. Under CDF, they are also procuring some mortuary units. Can cite places like Chasefu and Luingu. So going forward, we are also planning to do for the bigger hospitals, plan to have a refrigeration type of cold room, so that we can have most of our bodies to be attended to. But in the going forward as a plan, procurement plan, we plan to procure around 30 units for next year, so that we can at least address the challenges that the provinces and facilities are facing. Submit.
Thank you. Any follow-up questions, honorable colleagues? Or we'll make progress. Honorable Farrar, you can proceed.
Thank you, Chair. Chair, through you to the controlling officer. You compounded the issue of facilities that have more than 100. Is it more than 100? And you are talking to mortuaries that are like cold rooms. I think I saw something that you... Could you just amplify on that one? And give us a picture of where you are coming from and where you are going. Because that's, you have an opportunity to explain yourself. I know you talk legacy and... But I would rather, on an issue like this one, which is covering so many hospitals, you indicate where you are coming from, and I think those statistics will have helped us. You show where you are coming from, say this is how it was by 2022. We did 10 mortuaries, and our target was ABs. And that's why I think the committee is asking for what are your roadmap, what are your strategic plans in terms of ensuring that you have mortuary in each province or in each district that will help remedy the situation. Because when you talk in general terms, no one will really understand whether you are making progress or not.
Thank you. PS, you can proceed.
So that's a good intervention, and with your permission, Chair, I will ask the person from maintenance to speak to that about the context where we are coming from and where we are going, where we are now and where we plan to go next year and subsequent years. Thank you.
Thank you, Mr. Mbere. Can proceed through the PS.
Thank you, Chair. I think where we are coming from is not a very good site, because most of our mortuary units were installed in the 1990s, and we find that in the facilities, our cold chain teams, the refrigeration technicians are few, but realizing that we need to change the model of what we have, because increasing inflation as well. You find that some places there's just a 3-body unit mortuary, of which we have to increase the capacities of facilities in terms of how many body capacities mortuary units they should have at the district level, at a level 2 level, and at a level 3 level. So coming like what we have done so far, we started procuring 10 units, which we had to deliver in the most critical areas. Funding be equal, next year we are planned for 30 units, realizing that from just as I said, from our team, our one government policy, local government, there are also strategies that are put in, so that one. But for the ministry alone, we have planned to procure 30, so that as we go on, we increase the numbers, and maybe in the 2026 we can also increase more number. But for next year, we have increased to 30 from 10. So we are trying to make sure that we address the units, but also this is just to make sure that the funds that are coming, we are able to get as much as we can.
Honorable Wamnyima, progress.
Before we progress here, these
Thank you.
mortuaries that you're talking about under CDF, how are they being procured? You have CDF minutes for these, where they've, I want to understand how you are. And by the way, Chair, PS didn't answer my question on the why procurement for that. That these are it was queried in 2023, but ZAMSA is only receiving the issue in 2024.
Thank you. PS, you can proceed with that question. Then we'll have to make progress. Thank you. PS, proceed.
What was the first question? Sorry.
The first question, I think there's a question on CDF. Do you have minutes in the collaboration of those mortuaries? Then the earlier question was the issue with the Chipata General Hospital over the UPS, that if it was cited in the other Exota General's report, why has it taken ZAMSA now this year to procure? Why in short didn't the ministry kickstart that procurement as it were earlier? You can proceed, PS.
So for discussions with CDF and documentation, there are some facilities where there is just there are just discussions but not documented, but there are also some facilities where there is documentation to that effect. And I'll give an example of is it Kanyama or Chawama? We have documentation where they have agreed they are going to provide us with a mortuary unit. So some confirmed, some aspirational. For the Chipata Hospital, where it was flagged that we needed to replace that component in 2023, and we are only moving now. With your permission, Chair, I would request the Provincial Health Director for Eastern Province to interrogate that question. Thank you.
Thank you. Before the Provincial Health Director for Eastern Province comes in, we can have a break for 5 minutes again. Yeah, so PS immunity is lifted. I'll give you a break for 5 minutes, but we can just freshen up, and then you can make your phone call. You can proceed. Colleagues, you have 5 minutes.
Notice is hereby given to all members of Parliament and the general public that in exercise of the power conferred upon the Speaker of the National Assembly by Standing Order 259 of the National Assembly of Zambia,